We decided that really, given the nature of the forces who are pushing P3s, that we had to really be able to build a credible threat. And that meant to us that we had to be able to mobilize people en masse. We had to make visible to MPPs that their constituents were not happy with this. And we knew that if we could make the fight about privatization, we would win it in the court of public opinion. But if we didn't make the fight, we wouldn't win it. It would happen by default. It was already starting to happen. So we knew that we had to do a variety of things to, one, educate activists about what this was, this kind of complex idea and what it meant. Then we had to get the activists, give them tools to get out there in their communities and educate other people. And then we needed a way to mobilize people and make visible their opposition. So we did a whole range of tours with Maud Barlow, for example, from the Council of Canadians, with Dr. Alison Pollock from Britain, who did a series of articles in the British Medical Association Journal, held town hall meetings in every media center across the province, held community forums with economists, did the kind of education that people needed to really wrap their minds around what this meant for them. And then following that, we did mobilization campaigns. We did a giant rally at Queen's Park, our legislature in Ontario. 7,000 people came out. And then we held referendums in every P3 town. We held citizens' votes in which we dispatched volunteers across the community to open voting booths on a certain day and ask people to vote whether or not they wanted their hospital to be a privatized P3 hospital. In those votes across 6 communities, 80,000 people voted to stop the P3 privatization of their community hospital. And it didn't matter what political stripe they are, it didn't matter what political party they voted for. Conservative towns and Liberal towns and NDP towns all voted to stop the P3 privatization of their hospitals. Through that, we were actually able to roll back significantly the amount of privatization in the P3s. So in Ontario now, there are more than 36 projects that have been announced. Of those, 12 are 20 to 30-year deals. All the rest simply are construction build deals. So there's no privatization at all of services. There's no ongoing lease. It's just that the private construction company builds the hospital and then gets paid back after the 2 or 3 year construction period. The 12 remaining P3 deals are 20 to 30 year deals, but the government has issued a directive restricting the number of services that can be privatized. So most of those hospitals, it might be a handful of positions, hard maintenance, those types of positions in the hospital, and all the other services will remain public and nonprofit. So we're quite proud of that, obviously. I mean, it worked, and MPPs felt it, and they were worried about it in a way that was significant. But the fight isn't over, and for us to continue to build hospitals at too high of an expense, which will, down the road, reduce the number of services or the scope of services that you can provide in the public healthcare system, because it will siphon all that money off to profit and multinational investors, is still wrong, and we should still fight it, and we're doing so.